Discharge diagnosis. Number 1. Non-ST elevation myocardial infarction or NSTEMI. Number 2. Moderate coronary artery disease or CAD. Number 3. Cerebral vascular accident. Number 4. Hypertension. Number 5. Hyperlipidemia. Number 6. COPD or chronic obstructive pulmonary disease. Number 7. Chronic systolic congestive heart failure or CHF. Procedures: left heart catheterization, medical imaging tests to determine cardiac function in the left ventricle. Medical imaging used to visualize coronary artery stent placement. CT scan, MRI scan, posterior artery in the brain repair with stent placement. Brief history. This 72-year-old male presented to the ER with chest pain, shortness of breath, and left arm numbness. Patient has a history of hypertension, hyperlipidemia, chronic obstructive pulmonary disease, and congestive heart failure. In the emergency room, troponin levels and EKG results came back positive for non-ST elevation myocardial infarction. Patient was taken directly to the cardiac catheterization lab. Past medical history: hypertension, hyperlipidemia, chronic obstructive pulmonary disease, and congestive heart failure, asthma as a child, previous right total knee replacement. Medications: Norvasc, Lipitor, Lasix, Cozar, oxygen dependent. Family history: patient is adopted and does not know family history. All children are healthy. Social history: former smoker, no alcohol or illegal drugs. Allergies: penicillin and sulfa. Physical exam: general, alert and oriented ×3. HEENT, normocephalic and atraumatic hemianopsia. Lungs: few rales in lower lobes. Heart: regular rate and rhythm without murmur. Abdomen: soft, non-tender, without swelling or masses. Extremities: 2+ edema in lower extremities, no cyanosis. Hospital course: this is a 72-year-old male who was taken directly to the cardiac catheterization lab from the ED due to an evolving non-ST elevation myocardial infarction. A 98% close to the center right coronary artery lesion was treated with a Cypher 3.5 x 13 mm stent. The left descending artery showed 35% stenosis, and the left circumflex artery showed 25% stenosis. The image of the left ventricle demonstrated an ejection fraction of 40%. Following the procedure, the patient was admitted to the telemetry unit for observation. He remained in stable condition without chest pain, but developed tachycardia. The next day, the patient complained of a severe headache in the back of his head, with diplopia and hemianopsia. The patient was taken for a CT scan and MRI scan, which showed a thrombosis in the posterior artery in the brain. The patient was taken back to the catheterization room, where cerebral angiography was performed to remove the thrombus and angioplasty performed. Patient is being discharged home on routine meds to follow up with primary care physician within 7 days.